A very good evening to you, South Africa, those watching around the world. My name is Blain, Herman, and this is It's Topical. We're also live on SABC Plus. Our main topic: how are you treated when you visit a hospital, when you visit a clinic? Do you get a sense that you are a priority and that your needs are put first? The public healthcare sector, it continues to face significant challenges. Why? There's a number of reasons. One of it is trying to meet the demands of a rapidly increasing population size. The impact of inflation and the state of the country's economy are also contributing factors in some of the sector's limitations to service delivery in healthcare. What are the quick fixes? What are the long-term solutions? We will discuss. Which leads us to our question of the week, popping up there on your screen. With newborn babies recently pictured in boxes, and reports of almost 800 infants dying in Tembisa Hospital since 2020. Question: is quality healthcare still a pipe dream for some communities in South Africa? What are the solutions? That's what the whole program is all about. We give you the problems, but we need solutions as well. Let's discuss this. Is there a doctor in the house? We have two, in fact. Dr. Nicholas Crisp, DDG of National Health Insurance, the National Health Department. So good to have you on the program, as well as Dr. Bhengu, founder and CEO of Alchemy Health Technologies. Thank you very much indeed. Lots to discuss. Let's get a sense of where we are. Maybe let me just start with you, Dr. Bhengu, rather. Sure. You on the ground, working in various hospitals. You have a pulse, you have your finger on the pulse. To what extent is the healthcare system stretched or burdened, in your opinion?
Yeah, no, thank you very much, Blain, and I just want to greet your viewers as well. Yeah, I think the issue here is that practitioners, like everybody else, want to make sure that they work in an environment where there is leadership, where the environment itself is actually a pleasant one. And of course, there are the issues, hygiene issues, like, of course, what's important, remuneration. And also, for a system that works for the patient as well. That is also just part of the issues that I believe make up an ideal healthcare system. And obviously, ultimately, it's also about health outcomes. But the issues of how the system appears and how it is friendly towards the patient is definitely a critical one, and one that I believe we have a lot to do to get right.
Dr. Bhengu, is that fully understood, what Dr. Crisp is saying, fully understood in the medical fraternity?
Yeah, well, from the perspective of whether we have seen a fully costed bill, we haven't seen that. Certainly not in a manner that has been widely publicized. But I do agree, of course, that the universal health coverage is desirable. But my wish is that our regulators, when moving in that direction, because universal health coverage is not a destination, it's a direction, which is why I tend to agree with Dr. Crisp on that point as to whether we just need to wait until we can afford everything. But I wish the department wouldn't pick and choose what's in the WHO recommendations regarding universal health coverage, because part of it is about starting where you are. And where we are is a very vibrant, even though it's not completely even though it's not without fault, but it's a private sector that also works. And the issue of moving into a dispensation where the private sector, at least aspects of it, are excluded, I do not think that's in line with the view that said start where you are. There are regulations that are out to make sure that that is fixed, but that has to be part of our solution going forward. And I must state, I do not mean that anyone who's got an income mustn't contribute towards NHI, because universal health coverage is critical. But if after contributing to the NHI, you still want to spend out of your dispensable income on healthcare, that should be allowed. I do not see how that's a disadvantage, because you do have a system that you have a good chunk of people who are paying towards but are not using. at the very least, it helps the system start off the ground with fewer users than there are payers.
Yeah.
So I don't think that in that regard, but also I'm in between, because I also am not fully in agreement with our colleague who's also spoken from the perspective that you cannot start until you have all the money. I've referred to the point that universal health coverage is a direction.
Yeah.
And the example I always use is that it can't be true that Sanral can't start building beautiful world-class roads until every village has got a tarred road.
Yeah. Yeah.
We do need to start. My concern is that maybe our version of universal health coverage, when you call it national health insurance, our scope is narrower than it needs to be, because the problems that we can deal with are also structural, are infrastructural. I fear that maybe government is sleeping on a very good sort of program on ideal clinics rollout.
Right.
That's funded, but we are seeing regression, and that is primary care.
Yeah.
That does not even need what you would label NHI, but it's there, and it must be capitalized today.
Right.
That's what I'm talking about. When you talk about direction, there are many facets to this.
Right. Look, there's lots of issues or lots of aspects with regards to NHI. And I think in order to fully understand it, you need to have more information forthcoming. You need a buy-in from the public, because you don't want it to end up in a rich versus poor situation. Everybody needs to come on board if this thing is going to work. Welcome back. We're talking about the public healthcare system tonight, the sector as it continues to face significant challenges. And what we are asking you is, with regard to reports of these newborn babies recently pictured in boxes, right? Disturbing. Also reports of almost 800 infants dying at Tembisa Hospital since 2020. Is quality healthcare still a pipe dream for some communities in South Africa? And what are the solutions? Let us know at It's Topical SABC. I understand that NHI will be a process. And I'm not naive to believe that it is the silver bullet that will eradicate all issues. But when you hear what Michelle has to say, you saw the reports, would we get better with this system? Would these things, would measures be in place in order to put paid to certain issues? Doctor, final word to you, solutions?
Yeah, absolutely. I mean, I was going to draw on our COVID experience where it didn't matter that you did not afford private healthcare. If you needed an ICU at a private hospital, that was in place. That is what I'm talking about, that our resources in private and public sector are critical. The one thing that there are many issues, there's not just one problem, but what people outside of health sector may not know is that we really do not have a common way of measuring quality in this country. So if we do not have a standardized way of doing that, what is quality? To someone, quality is how long the queue is, and it's obviously they tend to be longer in the public sector. It's about the hotel side of the hospital. It's about the food. Is there a TV in my room? Bedside manners. All of those are important. But when it comes to health outcomes, we aren't moving fast enough. After the health market inquiry, there has been some movement, but it's still different players doing it differently, so it doesn't help. But from the public sector perspective, the Office for Health Standards Compliance, there certainly is a model that are 7 different key priorities that must be measured, that must be applied, and there should be consequences for facilities that do not meet that. And my opening line about ideal clinics, they also subjected to this. The issue is to fast track, make sure we standardize, then we can measure healthcare the same way.
Doctor, thank you very much indeed. Always instructive. Dr. Crisp as well, Michelle Clark, as well as a digital audience. Now, unfortunately, we run out of time, but appreciate your contributions on this program. Lots to discuss. We will continue discussing this on the SABC News channel going forward. We need to flesh out what NHI means to you and me. It's important. And thanks to all my guests once again. Until next week, take care. Bye-bye.